Sometimes people's records are huge. I mean, I've seen paper records within my hospital's record room. They're literally this thick. And so when somebody asks for all your records, they're not going to Xerox off all this stuff. And generally, what they limit it to is the last few primary care notes and your discharge summaries and things like that. I think the copying of paper records is going away. My hospital no longer has paper records. You can't ask for them because they don't exist. They took the existing records that went back so far and they scanned them into electronic files, and then they got rid of the paper records. And so this is really a problem of electronic access to records now. We set up a program within the INPC where when a patient applies for a Social Security disability, the Disability Determination Office will send that patient's identifying information to the INPC, and the INPC will send a summary of the information that's in that patient's record. And that summary is a document that we create that has most of the cogent information about that patient in it, but not all the different, diabetics can sometimes have hundreds of blood sugars. What you want to know is how well their diabetes is controlled. You don't need all those blood pressure sugars to tell that. There are other measures of that. So they'll give the other measures and not show all the blood sugars. There are these we call them case abstracts. They're summary documents that we'll send sometimes, and some systems will do that. So instead of sending all the data they have about a patient, they'll send a summary of those data. There are forces now trying to push us away from free text, what we call narrative medicine. I don't think that will ever happen. And we got to stop doing that. Because there are certain aspects of a patient's story that simply can't be told with discrete, checking off buttons or check boxes on a form. And so we got to just stop trying to get rid of it and trying to find better ways of using it, like with natural language processing. So that's one thing. The second thing is I think some sharing of the record between, enhanced patient access and sharing the records with patients is going to happen. I don't think there's any question of that.